Good morning, everyone. Welcome. Good morning to you all. My name is Meron Knikman, and I'm the president of the board of the Vrouwenraad, the Women's Council here in Belgium. And I'll be moderating this event for you today. We'll be focusing on the Access Project, a project focusing on migrant women and gender-based violence, a collaboration between GAMS VZ2, Forward UK, and Médicos del Mundo, and supported by the REC program of the EU. The project aims to improve the prevention, protection, and support for migrant women in Europe who are confronted with different types of gender-based violence. And this is also within the 16 days of activism focusing on gender-based violence. Maybe a few practical points before we continue. I can see certain people have their video on. This conference will be recorded, so if you do not wish to appear in the recording, feel free to turn off your camera. Best to put your microphones on mute, so it will be possible to hear everybody properly. If you have any questions, do write them in the chat. We'll keep an eye on the chat during the session. And maybe it would also help if you would write down your name and your affiliation, especially if you're asking questions within the chat. All right, I hope everything is clear. I'd say let's jump right into it and start with the presentation of the Access Project. And I'll give the floor to Jessica, who will be presenting the project, and also with partners from UK, Forward UK, Nana, and Médicos del Mundo, Paco. Jessica, the floor is all yours.
Okay, thank you, Meron. Good morning, everyone. Let me first share my PowerPoint presentation with you. If it's good, then you should be able to see it now. Yeah, okay. So I am Jessica. I am working as social assistant with GAMS. And I also was responsible, I am responsible for the peer educators. And so I worked in the Access project the last years. I'll be presenting the project now. So Access was a collaboration between three partners in 3 European countries. And was a project from 2018 until now. It will end now in the end of 2020. As Meron already says, Access is a project focusing on migrant women who are victims of gender-based violence. In our work as organization, we saw that migrant women have more risk of being confronted to gender-based violence. So actually they have a risk of being victim of a double violence. Next to the gender-based violence, they are also confronted to different barriers, like the language barriers, because people often have moved, maybe don't speak the language of the country where they are living, so it's difficult to access communication and organizations, support organizations. There can also be barriers in resident status. Some support services are not reachable for women who don't have resident status in a country. And there are different discriminations and racism also. I will not get into detail too much because our peer educators will talk about that later. What we see is that migrant women can be a victim of gender-based violence on different levels. Gender-based violence can be a reason to leave the country. If we think, for example, about female genital mutilation or forced marriage, people are not. It's not possible for women to escape this violence living in the country where they were, so they have to leave to be safe from that. But also during the migration trajectory, they can be victims of violence, for example, from the human trafficking people. But also once they arrive in the country in Europe, there are also different risks of violence. So they are really on different levels. And what we have seen as organizations working with those women is that the access for those women to support services is often difficult, sometimes because of the barriers. and sometimes also just because they cannot find a way to the support services, or they cannot just go there. So that is why we wanted to organize this access project, and the goal of the project was to facilitate the access of migrant women in Europe who are confronted with gender-based violence to support services. So not only to support women who are already confronted to violence, but also, very important, to prevent situations of violence and to protect women and girls against those kinds of violence. The project was axed on 4 important pillars. We started the project in 2018 with the training of peer educators and the training of professionals. And then we organized an awareness campaign and online support services. So this project was the same in the 3 countries where we organized it. The peer educators are people coming from different communities who often also have a migrant background and who want to engage in this subject and to support other women in their community. So we offered them a training of 3 complete weekends where we talked about gender-based violence, but where we also learned about how to talk about it and how to support people who are confronted with it. We also organized trainings for professionals to make them more aware of where violence can happen, and also to give them tools on how to support women who are a victim of it. That was the start of the project, and then we created the Access website as an online campaign. So the Access website, you can see the link here. On this website, you can find 4 videos, awareness videos, also a mapping of support services, of course, general information about the project, and the online chat to support women. The 4 videos have been made together with the peer educators and with women who were being supported at GAMS, because we wanted them to be understandable. So first, the idea was to make 4 videos about 4 different types of violence. But during the focus groups we organized with the women, they said that it's not really the type of violence who is recognizable, but more the emotion that comes with it. So that's why we created 4 videos related to 4 emotions who were pointed out by those women. So the 4 emotions that they link to violence are fear, stress, disgust, and pain. I'll maybe show you one of the videos now.
I am expecting a girl, how great. But my heart is heavy. What if she was to go through what I did? My daughter is 7. I was cut at that age. I am afraid, I have flashbacks. I don't want her to feel the pain. How can I protect her? I heard about a girl's arranged marriage within our community. I panicked. I experienced it, and soon my daughter will be of age. We want what's best for our children. We want them to have a good life. We want them to blossom. I belong to a community, which is great. We help each other out. My community is at the center of my life. I can't avoid it. They tell me what to do. I don't have a choice. They decide for me, for my daughter. But it hurts inside.
In Europe, female genital cutting and forced marriage are forbidden. The law is on your side to protect your daughter. You are in this situation, you want a way out, you can secure a better future for your daughter. Specialist services will support your fight for your own and your daughter's well-being in all discretion. More information on www.we-access.eu.
expecting a girl.
Okay. So this is one of the videos. The videos can be watched freely on the website of Access and can be used. They are often used by professionals to start talking about violence, for example. But they can also help women to recognize when they are in a situation of violence. They have, for example, also been shared and used a lot by our peer educators when working with communities. The videos exist in different languages, so English, Spanish, French, and Dutch, the languages of the countries where the project is in, but also in Arabic, Fulani, Somali, Amharic, and Tigrinya, the languages from the communities we work most with. And we hope to be able to translate the videos in more languages in the future. Next to the videos, we also made posters that have been hung up in the waiting rooms of different organizations to make the Access project visible and to encourage women to talk about violence when they are confronted to it. On the website, you'll also find an online mapping of support services. During the project, we have been assembling different organizations who give support for women, migrant women who are confronted to violence. This online mapping can be used by professionals if they look for an organization to refer a woman, but also by the peer educators, for example. And we wanted to make this mapping also available for the women themselves. So that's why we also used pictograms for if someone doesn't speak the language, for example, they can also find their way around. So as you see, you can select the country where you are looking for support. And then you can also give in some more specific information for your research. For example, the type of violence the woman is confronted with, which kind of service you are looking for. Is it, for example, juridical support? Is it medical help, attestation, social help? And when you do this research, then you are sent to the map where we show an overview of different organizations in certain regions where this support is given. And then you can see the contact information. So that way we hope to make the existing organization more accessible. Next to the mapping, you'll also find an online chat support service. Migrant women who are confronted to violence can connect to this chat during the week in their mother language. So if you access the website, you'll see that there are different time slots in different languages. For example, Somali, Arab, Amharic are there. So women can check in and they can talk to peer educators. So it's not a professional support service, but the peer educators are there to have a first talk with the women, certainly to listen to the women and to answer their questions and help them that way to access support services. The peer educators also organized awareness activities in their communities during the project. So the goal was to talk about the project, but also to make people aware of violence and of when they are in violent situations. So this was not online, but this was in a physical in the beginning. The impact of the access on communication level. During this time, we have been able to reach with the Access website 18,275 users who have visited the website in total 11,493 times. And for specifically the videos, they have been watched via the website 2,551 times. The videos are also on YouTube, and via YouTube they have been viewed 1,516 times. And videos are also on the GAMS Facebook page of GAMS, where they have been watched by 11,590 persons. Now we'll talk a little bit more about the specific situation in the 3 countries. So as I said, the project was all the same in the 3 countries, but there are of course specific contexts in the different countries. In Belgium, we reached 3 big cities with this project, so Brussels, Antwerp, and Liège. We have trained 19 peer educators who are now active. And we have also trained 250 professionals in those 3 cities. In the last 12 months, the peer educators have been able to support 128 women. We are talking here about direct support next to the chat. So they accompany women to services to give mental support, but often also to translate during the appointments. Through the group awareness sessions, we have been able to reach 1,335 people. In the beginning, it were physical groups, but because of COVID, we had to change our way of working. And the peer educators have been working more on via online. For example, we have done 2 weeks ago a webinar about violence in Fulani. And normally there should be one next week also in Tigrinya. So I'll give the floor now to Spain, to Paco, to present a specific situation in Spain.
Good morning. I'm Paco Llorente. I'm the coordinator of the Social Inclusion Projects Department in Médicos del Mundo, Spain. First of all, I want to recognize the work of all the staff involved in the project, especially Susana Vicente, that is the person in charge of the Access project. And she couldn't be here today with us. You could see all the peer educators formed in the picture, and also the staff of Médicos del Mundo involved in the project. We want to focus in this presentation about how we work, so with the migrant women and girls, and involving all the migrant community, giving them access to resources and services. So it's by the social awareness, as Jessica told before, the information and counseling, and very important, the accompaniment and referral to social services and to public services, because we think that our role is not just to accompany the people, but also to reinforce the social public services. Another important thing for us is that we consider all the people with the same rights, all the women especially with the same rights. So for us, the legal situation of each person is not really important to work with them, and also to give them the access of all the services. So you can see in the first block that in all the people who have worked in the project, 39% are undocumented. Only 30% have the status of residence, the legal residence in Spain. 22% family reunification, and 1% refugee or demanding the asylum status. Another important thing is the different gender-based violence identified. So principally, we have identified the intimate partner violence, and also the FGM that we thought before in the project, that because the community we are working with are really continuing with these practices. And in the other side, we have the people that we have, the women that we have trained, and we have created this network. So we have trained 16 women, but this network is growing, because as I told before, we are working with all the community and working also with different resources, allow us to really increase the impact of the project and the and activity of this network. in 3 different regions. You see the map up in the corner, and Madrid, Zaragoza, and Pamplona are 3 different regions in Spain with very different context, very different community conditions. So it's very important for us to really connect these regions, and also to see how we can work with the different communities and the different places. As Jessica told me before, we work in different languages, working with intercultural mediators to really create this confidence with the people that come to demand us information of resources. And just to finish this little intervention is that for us, this project is really important, and we have made our best to disseminate as much as possible in different medias. So we have the opportunity to show the project in radio, in TV, and also newspapers, instead our own social media or network. So that's all for Spain.
Nana, are you there for UK?
Yes. My name is Nana Utuyote. I'm the Executive Director for Forward. And just to share some snapshots of our project results, Forward worked with refugee women of Bristol who were based in Bristol as a partnership. So the project happened both in Bristol and in London, and we had part funding from the Big Lottery UK. In terms of the project, I'd like to really show appreciation to the opportunity to have this partnership. Unfortunately, we are Brexiting, so this will be the end of these kind of project interventions, which is really sad for some of us. But we've had quite a lot of successes, and we trained 22 community champions through our residential trainings, and it was a real opportunity for women to bond. And the network, the project has enabled women to really become closer. To date, we had 18 champions who were working with, and they joined. They are champions in the program in Madrid, again, which was an example of collaboration and reaching out, and an opportunity for a number of the advocates to link up with other community advocates from other countries, but also from their own ethnic groups. To date, in addition to the work, we've also trained 17 women in Bristol who have shown interest in the project because of the they've seen the benefit of the program, and this has been really effective for us in reaching out to different other community organizations. One of the things that has been really good has been the impact of the training, and impact on women themselves, but also impact at the community level. We have reached, again in London, 26 other women who've been trained. Though COVID has been an issue, it has not really stopped us from exploring using digital means to provide the training. So through our digital training, we've also had 26 other women trained in London with new partners. We've gotten requests for the community advocates training, and we've seen the advantage of community advocates, particularly during this COVID time. They were rapidly able to reach out and befriend other women and to support in terms of even welfare. And this has been a very strategic opportunity. And we see that community advocates and peer educators provide a real structure in our whole provision on providing services for migrant women who've been affected by gender-based violence. To date, we've reached 472 community members with outreach, but this excludes the amount of outreach that has been done, particularly through the use of Facebook. A number of community advocates, and one of them is Sierra Shraga, will share her example of how she used Facebook to reach so many other women. The direct support that women have had has primarily been through support around counseling, one-to-one support, and also through particularly befriending women. We have a specialist service, and that service is continuing to now have more online outreach, particularly through counseling and group counseling. I'd like to end my session here to showcase. You can see the hands that we have put here, and this is evidence of one of our community advocates. During the training, we had the opportunity to actually have henna painted on our hands, and we decorated our hands as part of our self-care during the training. Self-care was such an important part of our training because we realized that women needed support. Women needed some time out. They needed to be able to reach out to others and to really think about themselves. And self-care, particularly in this COVID situation, is an area that we feel we need to stress over and over again, particularly for our community advocates who are very much at the forefront of this work. The next slide. I'd like to end the next slide with a slide about our community advocates. And I'm so sorry to share that Hannah Ahmed, who is one of our advocates in Bristol, passed away this Sunday and was buried yesterday. And I wish to take this opportunity to talk about Hannah. Hannah was fearless and feisty as a community champion, and she was a community activist and a henna artist. And Hannah would always call us and talk about her work. She would call the mayor and invite him to meetings. She didn't have any barriers in terms of where she would go. She would go to men's meetings and speak about issues. And she was so fearless. She's gone, but she'll never be forgotten. She leaves a huge hole in the work of the champions in both refugee women of Bristol and Forward. And we will never forget Hannah.
Thank you, Nana. I suggest we take a moment of silence in commemoration of Hannah. All right. Thank you, Nana, for sharing that with us. As you said, Hannah may have passed away, but she'll not be forgotten. Yeah. Thank you also to Jessica and to Paco for sharing your experiences and the results of the project. We'll now move on to Kapung Lomodong, Community Program Leader for Forward UK. Kapung will share with us the standards of care of community support services. So yeah, Kapung, I'll give you the floor.
Thank you, Meron.
Thank you.
And thank you everyone for joining in that moment of respect for Hannah. So I will, I've been working on the project from beginning and the end. So I've been working with the peer educators throughout their journey. And what I want to share in this part is really around the standards of community-based services for migrant women. So let me just share my screen if I can. And this was developed by all of the partners on this project based on our experiences and our work with communities and migrant women who are affected by gender-based violence. And what we came up with was seven points that services can actually demonstrate that they are ensuring that they have an appropriate and culturally sensitive and holistic service that enables migrant women to access support. And so this would be, sorry, excuse me. This would include seven different points, and it's a poster that different services can put up. So one of the points is around having a rights-based approach to ensure that women are not discriminated, particularly if they don't have the right, perhaps women have temporary documents. A lot of the times women find it difficult also to approach services if they feel like their documents aren't able to allow them access, but if they are adhering to human rights-based approach, then they are obligated to actually fulfill the needs, the basic human rights needs, health needs of women. And it just ensures that women are not discriminated against or turned away from the really critical services that they need. And also in terms of in women's empowerment as well, as to empower women to, with information, to be able to exercise their own rights, and also in terms of their decision-making capacity. A lot of the women who are migrant women are also come from backgrounds whereby they haven't had the opportunity to actually enforce their rights or even know about their rights. And so this is really critical for increasing women's agency and their own ability to actually make correct choices for their own well-being, have information to legal support, and also be able to safeguard their children and themselves from further harm. And also access health services and appropriate information as well. And another area that really the project addressed was trying to increase the cultural competency of professionals. And that was through the trainings that we had. And the training was more focused around looking and reflecting on participants' unconscious biases. So excuse me. So we are all influenced by different cultures and different understandings of the way of life, and also in terms of migrant women's understanding of the world, perhaps migrating to a different society and culture will be challenging in terms of even being able to communicate their needs. And so in training professionals, it's really to get them to understand that there is another perspective, to understand the migrant woman's perspective of migrating to a different society, so that they're able to effectively communicate and also use tools that are sensitive, culturally sensitive for women's needs as well, as just a simple fact of using a language that women might not find offensive. So a key area is for us, especially, is looking at how we deliver our services in terms of talking about different issues around gender-based violence in a way that it enables women to even participate in that conversation. And also in terms of the trained peer educators, for us in the UK, we use community champions, and I know that in terms of the project, our peer educators, this is who they are, this is what they are champions for change. And they have been trained in terms of understanding the different areas of gender-based violence, and also how that impacts women in their communities, so that they're able to also provide services, they're able to provide peer support, and also be a really good link for women in the communities as well. And so that they are trained in a sense to be the link between services and community women. And also we've been in discussions in terms of actually this is really important to upskill community champions and peer educators further beyond the training that we have given them, but also become embedded in terms of the local referral processes or networks, and to ensure that that is really becomes part of prevention against further harm to migrant women. And another aspect which sometimes is overlooked is really the importance of community engagement and outreach. We have information as professionals, we have information, community individuals may have information, but also if we're looking at a social impact or a change whereby the whole community is able to actually safeguard women's rights, then we have to consider how we engage with different communities, community leaders, faith leaders, as well as being able to integrate that within service provision as well, for a more inclusive approach. So one of the ways, for example, during the time where everybody has had to work from home, it means that we've had to change our outreach initiatives as well, so that we can continually reach women, because that also face some challenges with digital exclusion for migrant women who don't have the skills to be able to go online, or don't have the simple basic tools of smartphone or data. So being able to address that so that we can actually reach the women was really, really important. And then we're looking at interpreting services and language support, which is quite a large barrier for a lot of women. And it's good that we're able to see one of the videos earlier, and that really demonstrates that also we are trying, if anything, to include women in a lot of the conversations. And even one of our peer educators have sessions where they have it in the local language, but also in terms of trying to improve the women's language skills to be able to understand the concepts that we are bringing forward to them as well. But it's important for services to also have a language service, so that women can freely express their needs, and also be able to talk about their own experiences in a very open way with professionals. And so one of the last points is really, in terms of embedding all of that together, is also developing local forums and networks and partnerships with local organizations, so that women are able to be referred to local support services. Sometimes on occasions we have women, for example, who have access to a clinic, but they want to access a clinic that's not close to them. They want to access a clinic that's further away, because perhaps they don't want to they don't want to be seen at a local clinic by somebody else in the community. So it's really important to consider what the woman's needs are in that situation, but also to be able to embed different services together, so that within the local area there is a consideration for women who migrate into the local area, as well as the wider nation as well. But that quickly comes to the end of my presentation. Yes, thank you very much.
Thank you very much, Kapung. I wrote down a few things. I like the part where you said champions for change. I think we can't underestimate the added value of community champions, indeed. Speaking of champions, we're going to move on to our peer educators. We have 3 of them today. We'll start with Shukri. Shukri Mohammed is a midwife, public health expert, and women's rights activist. She's been working on gender-based violence since 2003 and worked in several local international organizations in Ethiopia and Somalia, including the UNFPA, Save the Children, IOM, MSF. We're very happy to have you with us, Shukri. Another peer educator is Maya Miko Esnart. She is from Malawi and lives in Pamplona in Spain for the past 5 years. Studied accountancy in Malawi, business administration and management, Cambridge International College, and she's studying now for social inclusion at the Higher Technician in Social Integration. We also have Ishraga El Sheikh. She's a peer educator and a sessional support worker for Forward UK. And she'll be joining us as well today for the conversation we'll have with the three of us. So welcome to all three of you. I'm happy to have you here. Maybe I'll just ask you a general question. Maybe if you could highlight certain aspects of the project, how your experience was within the project as a peer educator, because you three were a crucial part of the project. Maybe Ishraga, I'll start with you. Is that okay for you?
Yeah, that's fine.
Yeah. Okay.
Hello, everyone. What shall I start? The Access Project. I would like to thank the people who put it together. We received 4 residential training. We started with London and Bristol, and we ended in Spain. We received professional training from professional people like Nana, Cabon, Evet, and Tox. The training was really informative. We learned about the different types of harmful practices and gender-based violence, and also how to look after ourselves. And we met people from different backgrounds and different nationalities. We received our certificate in Spain. That was the training and the delivery of services, which is done. I used the Facebook platform to advertise about the services. And we received many interests from women. And I was really shocked to see that women from my own community have suffered from the violence and different type of violence, and that was really an eye-opener for me. And also we used the online chat room because people now, they are aware of these services and support existed, so they contacted us. We sent them the link, they joined us in the online chat room, and they were really happy just to find someone to listen to them. And we referred them and signposted them for counseling services, and also for legal advice and housing issues. And they were really happy. And now they want to know more, because now they want to be independent. They know organizations such as Forward existed, and they can get help from the Access Project as well. So they want to know more, and they want to learn more. They want to be educated. They want to be independent. And also we did a number of outreach workshops for women, and we incorporated English as well, because most of them, they don't know how to speak English. They want to read their own emails and letters, because sometimes the people who suffered violence, they live together, so they wanted to know their rights through us. And the other things like the benefit, the benefit to the community. Now they're aware we existed, and they're reaching us. And also a personal benefit for me, I got a job through this training, and that's really good. Yeah. And I'm just hoping this project exists, and I hope this is not going to be the end of it. Now we live in the EU. Really sad. Yeah, thank you.
Thank you, Shao, for sharing that with us. Maya Miko, how was your experience during the project? What was it like to be a peer educator within this program?
Hello, good morning. And if you can hear me, I don't know if you can
I can hear you. Yeah.
Okay, good. Well, for me, the experience of this program has been very good. First of all, I would like to thank everybody who has taken part in organizing this project. Médicos Mundo from Spain and Forward and GAMS, all of us together. It was really good to connect with other peers educators. For instance, with our session in Madrid that we made, all of us, it was really exciting. As Chiara mentioned, when we got our diplomas, it was really exciting. And another thing that I would like to appreciate is the information I get, like from different types of violence that women in different moments of our lives we can be suffering. Also to open my eyes to see that in one moment or another in my life, I have passed through this kind of violence. And then to take like courage to look for help and support. So with my own experience through this process of looking for support, I can also share with the women I can help in future. Well, I already applied, during the process when I talk to different women and sharing how I have passed through my own experience, where I got information, where I got the resources. So it has been really, really informative, very good.
Happy to hear that. Thank you, Shaka. Shukri, you're here with us as well.
Yes. Hello.
Yes. Hi, Shukri. Always happy to see you.
Hello, everybody. Good morning. Thank you for having me. To start with my experience in the project, I have enjoyed actually throughout the project, and the content of the trainings, it was something I was already familiar to based on my experience and my profession. What I have more enjoyed is that the bringing the idea of accessibility of available services, it was really something that I was always thinking about by myself to create or to advocate for. So when these organizations come up with this idea, it was like that my dream come true. So so it was really great, something great for me. And when it comes to the trainings and participation of the trainings, it was joyful and happy moments, and we have it was like going to recreation and like vacation, one weekend that you spend in very luxurious hotels or places, and you interact with so many different people with different background, and also the creation of that a person like me as a single mom with two kids can be attending like these programs. I took my two children, and they were also in vacation with me, and they were attending, and there was someone who sometimes taking care of my children, and that was really something that is appreciable. And thank you for letting us to have access for that kind of service, and also to hear, for me, to hear from other cultures what they do, what they think, how the similarity of, because when you are working in this project, when I'm before I was working with two communities, community from Ethiopia and two community from Somalia, and those countries that Somali people reside, inhabit. So the two languages that I know, but now I can also help in English with so many different people with different background. That was also another opportunity. And yeah, for me, it's what was something that I was always hoping that there will be something like that in everywhere, in Europe, in America, and everywhere. Some organizations that work only to access, because we know that there is a barriers between people who need the service and availability to reach those services. So those barriers, there is still some barriers that exist that we will talk about later, and we will do some recommendations, but this is what I have experienced. Thank you.
Thank you. Thank you for sharing that with us, Shukri. It's a question for all three of you. Looking back at your experiences within the project, I'm wondering what are recommendations that you would, for example, like to make to decision makers? Who would like to start? Shukri, I have you on my screen. Maybe I'll start with you.
Okay.
Yeah.
As we all know that when someone, or especially a woman, migrates from the place that she lives and she is especially forced by problems and she's seeking international protection, they have or experienced through a lot of problems or a lot of challenges of life-threatening situations. And most of them are, when it comes to female or women, it's gender-based violences and discrimination and sexual abuse and all those kind of things. So whether it's something that originally pushed her from her own original country, or something that she experienced in the long way when she was coming to where she wants to seek a protection, or when she arrives, or when she's already here or in the process of asylum seeker, she is always prone to have those kind of challenge problems and GPV. And so in order for these women to get those access, as I already mentioned, there are a lot of barriers, whether it's the social services or medical services or whatever she wants to reach. And we come up with different recommendations based on what we have seen throughout the project. And my part is that I'm going to focus on the barriers of women, asylum-seeking women. I mean, asylum seekers who come to Europe. Most of the time, they get barriers of, first of all, language. So we would recommend that there will be a translators trainer to GPV, gender-based violence. Issue is not easy because these women are, they are new to this culture, they are new to these people, they are communicating with, and there should be someone who is familiar to the issue, who is very sensitive to sensitive issues, who already discussed or explained that they are, there will be confidentiality and privacy and everything of what she shares with them. And those things need people to be trained for, because I already mentioned it to so many places. I myself experienced it to some people who have been translating for me. They were so irritant of what I am talking about. And imagine that I am someone who is professional and don't care whatever they think, but imagine someone who is very cultural, conservative, or someone who believes and sees that what they are talking about is taboo. It will be difficult for them to share those kind of information. It will be difficult for them to gain the protection that they are seeking, because if they don't give all the information, is although they sometimes talk something and later on they talk something else, or discrepancy of the information is happen, then it's risky for them to not guide or get the protection they are seeking. It's risky for them to not have the help they are seeking medically, psychologically, and everything. So one issue that we really want to emphasize here and recommend is to train the translators to gender-based violence and sexual violence, especially because it's very a taboo issue, as we all know. The second issue is the psychologists who are seeing those people. So most of the time it happens that when someone goes or women go to a doctor, they see that this person needs psychological help, then they transfer or they recommend that they go to psychologist, or the social assistants send them to psychologists. But those people who have been already trained as psychologists, they may not be familiar to gender-based violence because of so many reasons. So also those psychologists or professionals need to be trained, specialized, to be given a specialized training to trauma-related issues and gender-based violence-related issues, because we have already mentioned that these women, one way or another, they have trauma. So they need specialized trainings to be given to the professionals of psychologists who are giving those services. So I don't know if I'm clear with that issue. I tried my best to emphasize it because it's really important issue. So I think those two are most important things. I don't know if I have to add something else.
No, I think that was very clear. So I wrote down, sorry, there's a police car passing by. The need for translators trained in gender-based violence for any type of appointment, and the access to psychologists who are also trained in dealing with trauma and the consequences of violence. Am I correct?
Yes.
All right. Thank you. Thank you very much, Shukri. Maya, maybe I'll move on to you. What would your recommendations be based on your experience the past months, past years in the project?
Well, I agree with Shukri, first of all. From Spain, we could add to call upon the European Commission to ensure and documented migrant women not to be discriminated due to their administrative irregular status when accessing to the services, so that they can be ensured with the healthy services, the urgent medical service assistance, sorry, and including mental health care in the pregnancy, even after giving birth. We would also like to call our European countries to ensure a special residence permit for these women who have no documents, so that all these survivors from many different kinds of gender-based violence to have access to justice, something like to work on, so that people are not afraid to take out the issues that they're passing through to the government or to the public, so that they can be attended equally. No fear. Thank you.
Thank you. Yeah, thanks a lot, Maya. All right, then Ishraq, I'll go to you. I'm guessing you would definitely have recommendations as well that you'd like to do, that you give to the decision makers.
Yes, because from my experience, there is a language barrier, and women who suffered from gender-based violence, they are really, and racism and discrimination also, they are in a compromised position. Therefore, also I'm aware of the new EU gender equality strategy, which is based on all women. And I recommend that the UK and the European Commission to acknowledge migrant women as a separate category, because they're facing other challenges and issues as well. And also, how would this be done? By involving migrant organizations to contribute in legislation. So those women can benefit because migrant organizations, they are aware of the issues faced by those women. And also, on the other hand, the other recommendation would be, I would like to recommend the UK and the European Commission to ensure that member states address the needs of specific migrant groups. These two recommendations, they're really similar, because my issue is like migrants, survivors and victims of gender-based violence should be treated as a separate category, so they can receive all these focus services, and they can benefit from it through by designing, because like I want sorry, I'm just a bit.
No problem. Take your
So
time.
you know, women organizations should be involved in designing and implementation and evaluation of these interventions, so so they can be tailored towards their needs and benefits. Thank you very much.
Thank you, Chiara. In the meantime, I see a lot of comments coming in. Only compliments for all three of you, Maya, Shukri, and you, Chiara. Compliments on your experiences, your competences, and the added value of having you within the project. As for the recommendations, I think you gave very valid points. I wrote down a few also to address in a bit with decision makers. And you've already shared quite a lot with us, but I was wondering whether there are any other gaps or barriers or any other experiences that you would like to share with us before we move on to the next part of this this event. Feel free to share anything that you'd like to address.
Well, I start.
Yeah, go ahead.
I mean, during this period, you know, for me personally, I felt like this satisfaction to be able to accompany women who have been or who might be suffering from violence, listening to them as a sister, as someone equal, you know, or the possibility of giving information through the information I received at the first press through during the courses we had, the trainings we had. I am really happy, you know, with that. I'm satisfied with that. And I felt something like also good from the women I at least attended, the feeling of connection when they were calling you sister. I'm passing through this and that. What do you think? What can I do? It's not always that I can give an advice or correct advice, but I think from my point of view, if this woman is open to share this with you and she feels that you are understanding her and you encourage, okay, from my point of view, I did this and that, just for her to have another point of view of her situation and even to know what resources are there available for her. And so when she decides to take step forward, she can go through those resources and count on you at the end. Okay. And another thing, I think that the project at least helped me with the strength, no? The videos that they were prepared for us, like peer educators, to use when in the session of sensibilization with the women or the communities, they were really, really helpful. I would love this project to continue, no? Not just to end like here, because I think there is a lot to do still. That's all. Thank you very much, Elia.
Thank you for that, Maya. Shukri and Mishaga, do you have something that you'd like to add?
Yeah.
Go ahead.
Yeah. I agree with Maya. The Access Project, women find it really useful, and I would like it to be, if there's anyone from the UK and the Commission, the European Commission, to acknowledge this, because women need this type of services to continue. Also, I can't emphasize enough of the language barrier and the discrimination these women face. And yeah, there should be like tailored programs toward their needs, especially with the language support. And so that will encourage them to be more independent and pursue their future, like learning, going to do a course, and ultimately finding a job that will prevent them from staying in a relationship that is violent, and to protect themselves and protect their children and move forward to their life. And that would be our ultimate goal as peer educators or organization that support women. Thank you.
Thank you. Thank you, Sraka. Shukri, I will not leave you without giving you also a moment to add your thoughts.
Thank you. Thank you for that. Actually, we have a lot of things to say, but we don't have enough time. So,
as usual,
yeah, that's not what we can. There's two things that I would emphasize. One is regarding the policy towards the parents of recognized girls, recognized protection seeker or girls who have been given protection because of FGM, fear of FGM. And there's issue in Belgium that there was, I think there was law passed, legislation passed in 2019 by Immigration Office that the girls have been recognized as and given protection, but the parents who are most of the time with the mother who came with the girl was not recognized as a refugee or protection seeker, and she was not given to protection. So this issue has a lot of problem on women, on this woman. So sometimes it's difficult this woman to have her rights as a human being. She's here living in Belgium, and I don't know if there is something issue like this in other countries, but we have this problem, and we have a child who has rights and her mother together or parents together who don't have. So to ensure, and I think this has to be, we recommended that to ensure all asylum system legislations are in line with the UNHCR guideline note to FGM as a guide for asylum, because it's really hard to have someone living in here and have no rights in here. It's not, and especially when it comes to gender-based violence, it's really added problem. So I don't know if I have more time to have another issue.
We don't have that much time left, but feel free to also add, maybe in the next segment, if you have questions that you would like to ask, please do.
Okay.
I wrote quite a few things down because you have a lot to tell us, and I think indeed time is short as usual. I wrote down a few things. I think the recommendations are clear as they are, but I also wrote the fact of funding, the fact it's great that there was funding for this project, but it would be great if things would not end here, but it could be something that could be continued over several years. I wrote down, Maya, what you said about accompanying women, listening to them as a sister, being there as an equal, as a huge added value for the community, for the women, and also the videos that you mentioned. and I wrote something down which I cannot read anymore, but that's okay. But I think it's very clear that this project, having peer educators, it's been a huge added value. And that a lot of things would not have been possible without you in this project. So thank you again for being part of it, but also for being here today to share experiences with us.
Thank you.
And again, feel also free to ask questions later if you like, for example, to our decision makers in the end. All right, we're running a little bit behind schedule, so let's move on. We have with us today also Saskia Bricmont. She is an MEP for the Greens. We have Johanna, hold on. Johanna Nellis from Grevio, from the Council of Europe, and we have Chiara Constantino. They'll be joining us today and giving their thoughts on the recommendations that we made, but also their experiences that they have working on gender-based violence. I'll start with Saskia Bricmont. She's an MEP for the Greens. She calls herself a feminist, and she's part of the Civil Liberties, Justice and Home Affairs Commission in the Parliament. Is a great defender of open, altruistic, and tolerant society. And for her, fundamental rights and freedoms are not negotiable. And she's also co-chairing the Intergroup for Children's Rights and aims to put children at the top of the political agenda to ensure all the coming generations have a better, brighter future. Welcome, Saskia. We also have with us Johanna Nellis. Thank you again for filling in last minute. Johanna has been working for the past 15 years in the area of preventing and combating violence against women at the Council of Europe. And from the first draft of the Istanbul Convention to its entry in force, Johanna has been there helping this treaty develop to its potential. And as Executive Secretary to the Istanbul Convention, she heads the Violence Against Women Division and ensures the Secretariat monitoring to the mechanism of the Convention, consisting of the independent group of experts, so Grevio, and the Committee of Parties. Welcome also to you, Johanna. We also have with us Chiara Constantino, a passionate feminist activist working as head of policy and advocacy at the END FGM European Network. She leads the advocacy strategy, plans, and activities of the network and monitors policy developments at national, EU, and international level. She's worked for several institutions, several NGOs, and she's also the coordinator of the Global Advisory Committee of I hope I'm pronouncing it correctly, Michichana Empowerment in Kenya. It's a grassroots organization working to advance the end of FGM and protect girls from it. Voila, I think that's everybody for today. Welcome all three of you. I'm happy to have you with us. Maybe I'll start with you, Saskia. You've heard, I think, a bit of what our peer educators already had to mention based on their experiences within the project. But I also you can definitely address that in a bit, but I was also wondering, as for the new Asylum and Migration Pact proposal that has just been released by the Commission, how would you ensure that the rights of migrant women will be addressed regarding the access to protection and care services? Maybe start with that for now.
Thank you. Thank you very much. I hope you can hear me well. Okay,
perfectly.
Great. Thank you. And I'm really sorry I couldn't join before because I'm really, I find it important to take the voice of the people concerned into account when it comes to lawmaking and decision making. And so I already participated this week to a conference organized by migrant women in Louvain-la-Neuve. You might know them because they knew about the Access project. And of course, I also know more now about this project. And I'm really interested in what you're doing and what you're doing with migrant women. And thank you also for the testimonies you gave, because I heard a bit of it. When it comes to EU legislation and specifically your question, the new Asylum Pact, I'm sorry, but I won't be positive because unfortunately the new pact as it is on the table now, as it is drafted by the Commission, falls short when it comes to women's rights in general, and even more specifically when it comes to migrant women or gender-based violences. The whole issue of gender mainstreaming is lacking. So this is one point that the European Parliament has to work on, and it's very high on our agenda in the Libe committee. I have several colleagues working on asylum, on migration, and gender mainstreaming their work. So I'm confident that we will be able to improve the pact in our negotiations at the European Parliament level. But so far, it's really disappointing. So in general, we probably share the view, the idea that current migration policies are very restrictive, and they have a particular impact on women and girls, and who are more likely to be victims of violence and human trafficking. And the whole consideration that women are escaping violence from their countries, and when they arrive in Europe, they're facing even more or new forms of violence and gender-based violence, including in Europe, in refugee camps, in welcome centers. So one of the first things to address there is in migration policies to offer proper training, and I think it has been raised to migration agents in order to include the specific welcome of women and girls on their migration path. More importantly, violence against women should be considered as reason for accessing the status of refugee. This should also be addressed more specifically, and it's lacking for the moment. So, as I said, the new pact is really falling short of expectations. Focus is still put on returns and what they call voluntary returns, with all the quotes, and also on solidarity basis with member states that would like to welcome refugees or would like to contribute to the return policy. So this is very biased or specific view of how solidarity should be organized when it comes to migration policies and asylum procedures, which we do not share. And we really fear for migrant rights and women's rights if, let's take the example of Hungary, that would participate in this broad solidarity at European level, but for the focus on voluntary returns. Hungarians' rights are not respected today, so I really fear for the respect of migrant rights if we come to that. The focus is also put on border procedures, which means we're not really escaping the current Dublin system, which focuses on the responsibilities of the first country of entrance to proceed with the asylum procedure. And so they're focusing on border procedures, accelerated procedures, and this doesn't answer the issue of the camps in the border countries, such as Greece, such as Italy, such as Croatia also, because we talk about a lot about the Mediterranean, but all the border countries are concerned. And it doesn't answer the problem of camps, of overcrowded camps, and all the issues that human rights, migrants' rights, and women's rights are facing in those camps, with all the lack of accommodation, of sanitary responses, of specific answers to the needs of women or of children. in those camps and so on. You probably know the reality better than I do. Also, they're putting, there's no proper mechanism that we've been asking for now for years of monitoring of human rights at the borders. You might have seen that we're now asking for an inquiry committee on Frontex because there are allegations that Frontex is participating in illegal pushbacks. Illegal because if they intercept a boat on the Mediterranean or migrants at the border, they have to check the individual situations of the people, and they don't do when they push back a boat without even checking where, if the rights of the migrants would be respected if sent back in a third country. So this is also not addressed in the new Pact of Asylum because they're entitled to reinforce the collaboration with third countries, and those third countries are Turkey or Libya or other countries which are not really respectful of human rights, right? So women are overlooked, and more broadly, the attention to vulnerable groups is not really addressed in this pact. So there's no gender sensitivity, no real gender mainstreaming, although the Ursula von der Leyen, the president of the European Commission, said that she was willing to gender mainstream policies, but it's really lacking so far in the migration context. No targeted measures to fully reflect the gender dimension of migration, I said it. And as Ashraga just said, migrant women should be addressed properly. And we see that it's not the situation. So to have a real recognition of the rights of all migrant women, their access to services, to protection, to justice, to health, also needs to be addressed. The importance also in the migration policies, as I said, to recognize gender-based violence as a reason to apply for refugee status, but also migrant women should be granted independent migration status. And it should not be tied to a spouse, a partner, an employer. This is something really important also. And this is also really lacking in the pact. It's the legal path, the legal migration path to Europe. And so typically the issue of labor markets, we should also address this specifically and with a gender lens to offer real opportunities for migrant women and migrant workers, and also address the issue of all the informal markets, which is dominated by women and also migrant women, with all the rights of workers that are not respected, the right to a salary and so on. So provide sufficient labor migration channels for women needs also to be addressed and is still lacking. Make me a sign if I'm too long, but there's so many issues that needs to be addressed, and I have to acknowledge that there's still a lot of work to do. So that's for the migration pact. And more broadly, I would say that Europe still has a step to put when it comes to the ratification of the Istanbul Convention, because we want that the European Union ratifies the text and applies it, because we know that member states haven't all ratified the Istanbul Convention and are violating some of its commitments also when it comes to the respect of women's rights, because member states should recognize and do not take into account the migration status of women in order to protect them and to ensure their rights. And finally, another important legislative tool that we have in our hands now is the victims strategy. So the Victims' Rights Directive from 2012 that needs to be actualized. covering all victims, whatever their administrative status. And the European Commission strategy on victims' rights released last July was mentioning undocumented migrants. So now we have to translate that into practice. And as the strategy is focusing also on vulnerable people, on migrant people, I really hope, and we will of course work towards that direction, that the rights of survivors will be taken into account and properly addressed. Thank you.
Thank you. Thank you very much, Askia. Yeah, there's a whole lot of challenges, and I think the list could indeed continue for a while, but I'm happy to hear that there are at least certain aspects that you will definitely address from your position within the parliament. I was also wondering, we're looking at the child rights strategy, which is also in preparation. What would be the place, or what would be the focus on migrant children and that strategy? Could you maybe enlighten us on that?
Yes, we've had several exchanges with the Commissioner, Sucha, and the rights of children in migration will be one of the pillars, as she said, of the strategy. So we are hoping that it will be properly addressed. What I think is that it's good to have a comprehensive strategy on children's rights. It's something that is needed in order to see in all areas of European policies, internal, external policies, how we can address children's rights properly. But this doesn't prevent all the DGs, the General Directorate of the European Commission, to then take those recommendations, those orientations in their own policies, because otherwise we miss the opportunity to children mainstream European policies. And for gender and children, I really think that we need impact assessments that include the assessment of the impact of our policies on gender rights, on equality, and on children's rights. If we do not do that, we cannot properly evaluate our policies and see if effectively they address, of course, and they don't have adverse consequences on the rights of women and children. So I do not want the future strategy on children's rights to be a new catalog, a new Santa Claus catalog of good intentions, because I think in all areas, including migration, we know what needs to be done. There are a lot of recommendations. There are a lot of resolutions that we already have taken at the European Parliament level. The Council of Europe has issued a lot of very good recommendations and texts to implement effectively the rights of children, including in migration, addressing the issue of unaccompanied minors, for instance, and what needs to be done at EU level and by member states, because it's also the role of member states to address those issues and to cooperate together. The issue of detention of children in the migration context is not solved yet. Everybody recognizes that this shouldn't happen, but when it comes to really implementing this policy, we see that if we do not address more broadly the issue of detention in the migration context, children with their families, for instance, we have no good answers to this, and we really need in our member states also alternative policies to detention, communitary housing, and so on. And this needs a real change in the way current migration policies are seen, are restrictive, seeing migrants as criminals, and they need to be detained because otherwise they will escape us. This is the way, and even when it comes to children, the way most of our governments still apprehend migration policies, and this needs to change. We always try to include, and we just did it in the report that my colleague Tineke Strik issued on the Return Directive, the exclusion of detention of children in the migration context. So step by step, we are including this dimension in the legislative text, but still it needs to be addressed. And for instance, in the current pact, other procedures are still including children above 12 years old, excluding them under 12 years, but a child is a child at 12 years old. The Eurodac regulation, so on the exchange of data in the migration context, foresees the fingerprinting of children from 6 years old, which means that their data will be retained for at least 10 years. So it means until they're 16 years old. Can you imagine that they are filed as children? And if you know, they commit some small daily something bad, you know, at 16, when you are a teenager, they might face problems and immigration problems because they were taking their fingerprints. This is not the best interest of the child. This is not taking the rights of the child into account. So we're really opposing this. We're really fighting. I'm working on this file, but majority in the European Parliament, conservative majority, unfortunately, still is not opposed to this. So there too, a lot of issues to address. The situation of girls also in the migration context need to be properly addressed in the strategy. But I again insist that strategy is good, but it needs to be mainstreamed in all European policies, and we are not there yet.
Mm-hmm. Clearly. There's still clearly a lot of challenges ahead. Thank you for this, Saskia. We have several questions for you, but I'll just first go to Johanna from Revio. Johanna, welcome. I was wondering whether you could maybe present us some key points from the Belgian report on migrant women. What the main findings are there. And I don't know if you could speak about the Spanish findings yet, as the report is not released yet, but maybe you could shed some light there if possible.
Yes, thank you, Meron. Hello. I actually just got cut off from the connection as you were introducing me, but I managed to reconnect, so here I am. Thank you, thank you very much. A lot of really important barriers have already been mentioned to the support and protection of women, migrants, and asylum seekers for their experiences of violence. And before I start, I just wanted to basically just share a few general reflections around the Istanbul Convention, because most of what has been mentioned today already in terms of barriers, but also in terms of recommendations, are actually part and parcel of the Istanbul Convention. So this legal treaty offers a really good starting point for anyone doing advocacy around any of these issues. And it is legally binding, not on the UK, but on the Belgian authorities and government and the Spanish, as we've heard, you know, many experiences shared from these three countries today. So yes, on that note, I just wanted to start because the convention offers, sets out a lot of standards and legal requirements to prevent this type of violence from happening to all women or any women, and also it also offers a lot of obligations to set up services and to support and protect women who are experiencing this type of violence, and then also invest in prosecution. And the extent to what this is done in practice is being reviewed by the independent group of experts, Grevio, which was already mentioned. So they really look at national level and try to assess the level of the implementation of the entire convention on the ground. And they do so with a specific focus also on migrant women and women, in fact, all women, because one of the basic principles of the Istanbul Convention is that its provisions should benefit all women, irrespective of their characteristics. So irrespective of their residence status, their age, health, passport, anything. And so this is really something that Grevio pays close attention to. And almost every single report issued so far it has made this a really strong point in the very beginning. So asking governments to step up their efforts to ensure that the provisions really do reach and benefit each and every woman, including migrant women, because of the reasons that have been mentioned: language barriers, barriers to accessing information, barriers to accessing services, support services, and or the fact that, where services exist, they might not operate on a cultural sensitive sort of, basis, and may not actually be offering the type of help that a migrant woman would require, etc. So these are all issues that Grevio addresses in its reports. But the Istanbul Convention also has a very specific set of obligations in relation to migration and asylum, and so this is what I'm going to focus on just briefly. You're probably all aware that many women who migrate depend on their spouses or partners for their residence permit in the host country, and if they're living in an abusive relationship, the Istanbul Convention makes it a requirement to allow them to leave without the fear of deportation. So governments need to find a way of issuing residence permits for women in such a situation. So this is what Grevio looks at very closely, and on a general note, we can see a lot of legislative amendments to this extent. So a lot of countries are, in fact, changing their immigration laws to make this possible. And of course, in the case of Belgium, this was looked at in much detail. And here, the group of experts saw that there is some sort of possibility. A certain amount for protection and for a residence permit on these grounds, but the experts found quite a lot of very technical, detailed regulations that actually make it in practice very difficult to actually lead to a satisfying result for a woman who's in particular married to a non-EU national. So this is the hardest, the most difficult group, or the group of women who have it the most difficult in obtaining their own residence permit. All they can rely on is on humanitarian grounds with high obstacles or high thresholds for application, including because a large fee is required. So after having assessed the situation in Belgium, the group of experts came to the conclusion that really Belgium should be reviewing or should undertake an in-depth review of their immigration laws and policies and bring them more closely in line with the requirements of the Istanbul Convention. So this is an obligation on the part of the authorities in Belgium now to look into that. There were also a few interesting findings, good practices that were revealed in looking at Belgium, because there's quite some effort made at identifying vulnerable women in the asylum process by carrying out individual assessments within the first 30 days of arrival. So this is good. It's important to screen for vulnerabilities and to understand who needs support and what type of support. However, there are problems in practice, because once individual women have been identified as in need of a specific support, such as maybe counseling or health support or something, then following up on that is quite difficult, because waits are long for a health check or for a specialist health appointment, and also it doesn't necessarily mean that women are then, asylum-seeking women are then transferred to an accommodation where, for example, trauma support or counseling on a specific form of gender-based violence would actually be carried out. So identifying women in that situation is good, but what the experts are saying is that really the next step must also be ensured that services can actually be provided once women have been identified as in need. There's also, in terms of the actual gender sensitivity of the asylum procedure, this is also a requirement of the Istanbul Convention. The process needs to be carried out in a way that allows women to disclose their stories, and here the issue of interpretation has already been mentioned. Grevio didn't mention this in relation to Belgium, but in so many other countries, Grevio has found a real need to step up the the level of trained interpretation. So making sure that it's not just through a video platform that interpretation for asylum interviews can actually be ensured. It should really be face-to-face interpretation by someone who's of the same sex as the asylum seeker. So investing in female interpreters is important, and also making sure that they're trained. And this is also a point that has been mentioned today. We've heard, the Grevio experts have heard many stories where interpreters simply couldn't handle the stories that were being told by asylum-seeking women in the interview because it was too heartbreaking. So this is something that shows just how big the need is to invest in this area. So there's also yes. Sorry, I was talking about the gender-sensitive procedure. Grevio has also looked at the way these procedures are carried out, but also, of course, the legal requirements for such procedures, and has seen in Belgium that border procedures exist and that often lead to accelerated procedures. This is something that many EU countries of course, apply in relation to asylum processing. And it's both in the context of Belgium and Spain that Grevio has seen difficulties in ensuring that, because in accelerated procedures, it is very, very difficult to ensure that women are given the time and the room and the space to really open up and to really tell their story, and also to be prepared for the importance of that interview, because earlier today, arriving in a new country, and if, for example, as is the case in Spain, for the sea arrivals on the coast of Spain, the very first person that an asylum seeker, including a woman, will see is a police officer, and knowing that this is a person that she will have to confide in, basically, and tell her story, is of course a lot to ask from someone who may have had very different and not so positive experiences with police in her home country or on her journey to Spain, for example. So these are all elements that have been identified as standing in the way of really ensuring a gender-sensitive procedure for women asylum seekers, and I could list many, many more. There are also issues in relation to, of course, accessing the procedure as such. This is something that you're all aware of, I'm sure. Arriving at a point where an asylum claim can be made can be quite difficult for some women. We've already heard about the pushbacks, etc. So Grevio, in its work on Italy, Spain, and also Malta, and these two countries, Spain and Malta, the reports have been published last week, so you can take a look at those on the Istanbul Convention website. In relation to all of these three countries, Grevio has queried the approaches taken to the arrivals by sea, and it has raised serious concerns regarding the issue of refoulement, because if women, and of course this would apply to other asylum seekers as well, but if there's no possibility to even access the procedure, if asylum seekers are turned away without being asked for their purposes of arriving and given a chance to actually apply for asylum, then this of course raises serious concerns under Article 61 of the Istanbul Convention, which reiterates the principle of non-refoulement, not being turned back to a country where you may be facing risks. So these are many, many issues that have been raised, but yes, and the concerns and the particular difficulties of migrant women and asylum-seeking women in finding information, in knowing where to turn to, and legal barriers to actually accessing services. They run through all of the Grevio reports on all of the countries looked at so far. So this is an issue that's definitely being given a lot of attention by the experts. And maybe just as a last note and a last comment, what is interesting to see across the board is that women who are in the asylum procedure and who are accommodated in asylum reception facilities have it very, very difficult to actually access mainstream domestic violence support services, such as shelters. Often, not in every country reviewed so far, but in many countries, Grevio has noted a real parallel system in a way, because if a woman in a reception facility needs help for experiences of domestic violence, for example, then often it's the reception staff that will try to help her rather than orient her towards a specialist service, which of course exists, but there may be legal or financial reasons that would bar her from accessing those services. And in some countries, there's still lots of difficulties around ensuring asylum-seeking women a stay in a domestic violence shelter because of the funding that might come with it, because they're meant to stay in a reception facility and not in a domestic violence shelter. So there are many practical and legal barriers as well. But this parallel system of providing support to asylum-seeking women within the system of the reception facilities is something that stands out to quite some extent.
Thank you very much, Joanna. It was very clear, very elaborate explanation on the key points of the reports. Thank you very much. I'll continue right ahead with Chiara Constantino. She works for End FGM EU network, and yeah, she'll fill us in a bit on the role of NGOs in the field and the more structural work needed on national level. Chiara, the floor is all yours.
I don't know how I feel about being in a panel with the institutions, but being a European network, so thank you very much. We are a European network of NGOs, 30 NGOs in 14 European countries, and actually the three partners of the project Access, GAMS, Forward UK, and Médicos Mundo are our members. So it's within this role that I'm here speaking with you. And indeed, like, I think it's really, it falls well into what I would like to present, because we heard a lot about the standards and what the legislation at European Union level and at Council of Europe level says. But and we worked a lot as a European network on this, of course, on ensuring that all these not only the Istanbul Convention, but all, for instance, the Common European Asylum System and all EU legislation, the Victims' Rights Strategy, are really gender sensitive, with an approach that is looking at women's rights, girls' rights, and migrant women specifically, and asylum seekers. So, but then it comes to the member states, it comes to the implementation. And I think that that's what we saw as a European network, having this kind of umbrella overview at European level. So being a bit the bridge between institutions and country and our members, we really see that even though standards might be there, then at national level, these are just not implemented, or are maybe implemented in some countries, but then in others, there is a really huge discrepancies between countries, and also within countries, to be honest. So that's we decided, so we worked a lot on indeed asylum and migration over the past 5 years. But since a couple of years, we decided to go a bit deeper into really looking at what happens at member states level. And we really, with the key objective of looking at indeed gaps of implementation of European and international standards, seeing what are the challenges, what are the good practices around the implementation, specifically in this case of Istanbul Convention and the EU directives on qualification, procedures, and reception conditions within the asylum package. So with this in mind, I just would like to briefly tell you a bit of the kind of the key findings that we had in terms of what are the issues where we see the biggest variety among member states, and where we really should work more in terms of both at EU level, at Council of Europe level, but also specifically at member states level, to ensure that there is more homogeneity of standards. Because I think that our key goal is really that the future and the life of women and girls cannot be left at the lottery of where they end up, in which country they end up. Like, they need to, if we really want to be a European Union and a union of rights, of support, of standards, you know, for vulnerable people, including women and girls affected by GBV, we really need to ensure that we all have the same standards, and that should be really the top priority of everybody. So, yeah, so looking at qualification, for instance, one of the key things that we found is that there are, even from the basic information on which the countries base their asylum assessment, it varies a lot. Like the country of origin information, which are these reports that the countries use to base their assessments on, the asylum assessments on, are completely different. Like, some countries have their own, they have their own sources. Some others use, for instance, the common ones, which do not have gender analysis, do not have gender lens applied to, you know, the safety or the situation of the country. So just the very information that countries use to determine whether a woman or a girl can be a refugee is different. So of course, the outcome will be different. And this is the big problem in the qualification. So for instance, there are countries in which actually FGM is not, this is specifically about FGM, of course, in this case, like, it's not considered as a gender-based persecution, as it should be according to international standards, but it's a form of subsidiary protection, which is linked to torture. So it's not really that big of a difference, but it is, because it's not considered as a gender-based persecution as it should be. So that gives then differences in treatment, of course. In other countries, for instance, women and girls who are already affected by FGM are recognized. In the majority, however, not, because it's considered past persecution and not future persecution. And this is not put into the continuum of gender-based violence that every woman and every girl face throughout their lives. And we heard about it from the speakers before. What Shukri mentioned, in Belgium, there is a specific issue with parents and not being recognized, parents of girls who are at risk, who are recognized. So that's, again, a big issue. So in general, there is really, in terms of qualification, a lot of discrepancies, and this really should be addressed. In terms of procedures, so there are two key issues that we found, specifically for the possibility of choosing the preferred gender of the professionals within the asylum procedures. And we mean by professionals everybody, like not only the interpreter, but also the caseworker, but the even the lawyer, like anybody that the woman or girl encounters. And we don't necessarily think that it should be the same, but it should be up to the woman and or girl to decide which gender they prefer. Like, it's it can be that they are more comfortable with a man, for instance, than with a woman. So it should be left to their choice, actually. And this is not happening at all in all countries. In some countries, it's only possible for the interpreter to decide. In some others, it's absolutely not possible. In general, in a few, it is actually possible, and it should be implemented. In some countries, it is given the opportunity, but on the other end, girls and women are said, okay, but if you choose the gender, then your application might take longer because we need to find people with that gender. And so, of course, this is a deterrent effect, and women and girls are not really given a free choice if you then tell them, because they are in this situation that they, of course, want to be as fast as possible ready with the application. So. And then in some countries, there is a possibility of having a person of choice accompanying the women and the girls throughout the procedure, aside of the lawyer. And this is I really think is a good practice that we would like to see in more countries. Another big issue in terms of the procedures is access to legal assistance. Because we, in some countries, this is done, for instance, in Belgium, it is. So it's done since the first instance. Of course, you have to meet some criteria, but it is available. While in other countries, it's only on second instance. So you have very big discrepancies in terms of the preparation that asylum seekers have within the asylum application. And the last point that I wanted to mention in terms of reception conditions, of course, This is one of the biggest issues because it's really also very territorial. So it really depends a lot in terms of whether the competencies are within the country. So of course also Belgium, but also Spain, like it's very different in terms of regional competencies, but we saw that in general reception centers are not they are not built in a gender sensitive way. So sometimes they don't have specific spaces only for women who are victims of survivors of violence, for instance, or children. Common areas are not, they don't have a gender sensitivity, so they are all occupied by men, and yeah, women cannot really access them. There are some good examples in some countries where there are even services within the reception centers, and they are really integrated into a complex system of coordination on prevention of gender-based violence, FGM, including FGM. So this is really a good example that we would like to see more, but this is really access to services, especially because reception centers are very far from all the services. They are not connected, there are no referral systems. So yeah, just wanted to mention that European standards, international standards are there, but we really need to ensure that they are implemented. And as civil society, we are the watchdog, and we really want to put that to the decision makers. So thank you so much.
Thank you so much, Chiara. I think indeed it's the implementation where the issues are. Saskia, I think there are a couple of questions for you in your capacity as of MEP, because indeed the standards are there. You mentioned earlier the challenges that still lie ahead when it comes to the proposal made by the Commission before. A lot has to do with access to protection, access to information, access to services. So I'm wondering, in your role as an MEP within the European Parliament, yes, there's a conservative majority, but on the other hand, are there allies? Are there specific reassurances that you could give us, that you could give everybody present here, NGOs present here working on these issues, on what could be possible, what is possible? Because the challenges are clear, but I think we're all looking for something to sort of hold on to, something that could be a bit more concrete.
A bit more concrete and positive. Well, there are issues where we can get a majority in Parliament to work on. I think typically that we can work on gender issues, on children's rights, and the issues that we've been talking about here. But the current text, as presented by the European Commission, is already a compromise with the member states. So the Commissioner Johansson made a tour in the member states this last month in order to already have their views on the texts and discuss with them. For instance, the solidarity mechanism, would they be happy with what is on the table right now? Because we know that if the whole pact, Migration and Asylum Pact, has been blocked in the Council those last year, it's because several member states didn't want to engage in a solidarity mechanism in order to prevent what is happening at the borders and in border countries. So what is let's say the space, the room we have to change the text at the European Parliament? We have to play our role, of course, as co-legislator, and we will amend the text. But as we know, it's already a compromise with the member states. Our scope of action is quite limited, and it will be very difficult to change the orientation of the text, which is bad, which is still relying on restrictive migration policies. No positive approach of migration, very few interesting issues about legal path of migration. It's not addressing issues related, for instance, to climate change, and how do we cope with that at the EU level. So we will work, of course, in detail to improve the current texts. And again, I think that we will find majorities, and the Libe committee has been working on these issues and the question of women in migration. We have several texts on, it has been said, the strategy on gender equality, and different texts that we've been working on, and including better wording, let's say it like that, in our words at the EP level. But we will not change the whole narrative about migration, and we need you for that. We need all the NGOs for that. And this is also something we are always recalling, the protection, the proper financing of NGOs, the non-criminalization of NGOs in the context of migration is crucial for us, because we need your lobbying, your positive lobbying on politicians when it comes to, as well, the European Parliament as the governments, because now, today, the main obstacle are our governments. And we need you to
just there, Saskia, because speaking of governments, sorry to interrupt you, because I would think when it comes to implementation of once a text is there, is it's not so much competence of the Parliament, but more the Commission. But then again, you as an MEP and other MEPs in the Parliament, you do have, of course, close connection to parliaments and politicians elected within your own countries. So how you could use maybe that role to ensure, or to maybe more ensure implementation within those member states, because that is the main issue here.
So what we do is that we work closely with, I work closely with my colleagues at national level and regional level in Belgium, because we have several parliaments. And on migration issues, I will be honest enough to say that it's probably one of the main policies that we lost as Greens in the current governmental coalition. We were, and it's a surprise for no one, very disappointed about the content of the federal government agreement. So the space we have to influence positively the position of the government is quite limited, but we still do. There are issues where I think we can make progress when it comes to detention of children, because that has been acted. The issue of unaccompanied minors, because this is also linked to regional competences in Belgium, and there we have a minister in charge of children's rights that can work on this. So we, of course, try to build alliances and so on. But when I see the global orientations of the national governments, also the French government, which was pushing for a solidarity mechanism. But once we have this text, they're not really working on a new narrative, on a new way to apprehend the whole migration issue. They're still happy with the mechanism at the borders, because it makes it easier for them. They're still not questioning the consequences on the existence of camps in our border countries. They're not questioning the legal path. No government is really active on legal migration issues. And so I think, yes, we have a role to play, of course, as European MEPs. We're working in Parliament, we're working with our national counterparts. But we know that citizens' mobilization through NGOs and individuals really count. I will take one example. In my region, we linked to the COVID, we were facing a lot of problems because most of the local politicians were seeing that as a problem of transit migrants on their way to Great Britain. And one small area here next to me was called the Little Jungle, referring to another jungle. And we really built, and this was my national colleague, Marie-Colline Leroy, an alliance in my region between the different political parties and stakeholders, working with the citizens platforms, so the mobilized citizen individuals welcoming refugees, to try to find common answers. And we agreed, so my region is called Wallonie-Picarde, some of you may know it. We agreed together to have different possibilities, a house of information and first care for migrant people, mainly in transit, but also a night and a day house for people with we're trying to find now a place welcoming also exclusively women, because it's needed and because they also need to be protected. And this is something we addressed. So this coalition of mayors that were facing a reality on their territory made it possible to have a real solidarity response at local level. And this is now influencing, and we hope it will be influencing positively, the regional and the federal positions, because we also need at local level the help and financial help of the federal government. So we're trying to build alliances where we can, but it shows that we need citizens, because the political answer provided in my region is not coming from nowhere. It's coming from the mobilization since 5 years now of individual citizens that formed these citizens platforms and the Welcome Refugees platform. And this is crucial.
All right, thank you very much, Saskia. We still have quite a few questions, but looking at the time, we're already running a bit late. So I'm afraid we have to wrap up here.
I'm happy to answer by written if you can address me written questions, and I'll make sure you get an answer. That's
perfect. Oh, thank you very much. I think participants will be happy to hear that. Thank you. I suggest to move on to our next speaker, Linda Lea Nirenda. She is a very talented, very beautiful, very very outspoken person who will give us a short performance on slam poetry. She's been working on several issues, a lot related to also gender. Linda, are you there? Because I don't see you on my screen yet.
Yes, I am.
Perfect. Hi, Linda. Good to see you again. I'll give you the floor. You work your magic as you always do.
Okay. Thank you so much for your kind words, Meron. Good morning, everyone. My name is Linda. I'm a poet and spoken word artist. This year, I'm co-starring in the play Killjoy Quiz, which is directed by Luanda Casella and produced by Untitled Theatre. It is based on works by feminist Sarah Ahmed, and in the play, we explore inherent biases and violence in everyday language. Hopefully next year, we will be able to tour Europe. Now, as a poet, I use storytelling and mythological imagery as a connective approach to activism. Instead of describing situations, I try to describe the feelings that surround racism, sexism, and other types of discrimination in order to stimulate empathy and understanding. Today, I'm going to combine two texts. The first one is called Ragdolls, where I talk about agency and activism and why it is important to look at the strength of survivors. No one should be permanently labeled as victim. People are much more than that. In the second text, I would like to explain one particular imagery. I will talk about dawn's rosy fingers igniting the burning skies. And this is a metaphor that I borrowed from ancient Greek writer Homer. He saw the morning sunrise as the fingers of a giant goddess, the goddess Dawn, who stretches her fingers across the sky. I often like to mix well-known and lesser-known cultural or literary references to connect with audiences. Now, my objective is to create bonds between cultures through parallels and mutual respect. I love the imagery of the sunrise as a progressive force for social and political change, much like the sunrise movement in the US. Now, Homer uses the sunrise as a chorus throughout his poetry, which has a calming and comforting effect. I like the idea that no matter how bad things get for the protagonists of the story, the sun rising means that they have lived to see another day, so that they have been given another opportunity to change their own fate. I love that message of hope and resilience, which is what I have witnessed here from all the speakers today and your colleague Hannah Ahmed. So I dedicate this to all of you. Ragdolls. Once the ragdoll, ever the ragdoll. It's hard to grow bones when no one showed you a heart. They always focus on your ending, never granting you a start. Some say you've got talent and ask you where you've been. I'm a minority. I'm not supposed to be seen. I'm supposed to be demure and keep my ankles crossed. The more pigment in my skin, the more I will be bossed. And they say the darker the berry, the sweeter the juice. But that should be the darker the tree bark, the more common the fruit. But minority or not, if we want to be heard, we should at least shout louder than the auctioneer's last words. It's not just our pride that is up for sale, but that of future generations when the wrong isms prevail. So we can stand united or perish alone, own up to ignorance, or let them send in the drones. We can shrug our raggedy shoulders or be bold and say, whatever happens tomorrow, we'll try harder the next day. Because there's no red dress or velvet lines that sink in the abyss of smoky eyes. But if clothes told tales and walls could recount, what nurseries of woe do you think they would chant? While dawn's rosy fingers ignite the burning skies, I'm testing the waters below. Just one more dance and I'm good to go. I'm just testing the waters below. Just one more dance and I'm good to go. There's no criminal or savvy saint that condones this scheme marked with black-faced paint. But if facts are alternative and delusion is a choice, then how come ignorance gets the loudest voice? And if insult is personal and speech is free, then why don't your freedoms apply to me? Because when it comes down to rules and regulations, yes, we always find time to perpetuate miseducation. So I don't know what you know or what you've been told, but birds need to learn to fly before they're too damn old. We can't let adverse winds stunt our initiation. Maybe we're just meant to fly in another direction. Still dawn's rosy fingers continue to ignite the burning skies. We should be testing the waters below. Just one more dance and we're good to go. We should be testing the waters below. Just one more dance and we're good to go. So let it roll off you. Let it roll off you like the water off a duck's back, like a broken 8-track. 'Cause like a hurricane's path, you can't hold us back. You can't hold us back. Thank you so much.
Please do turn on your mics.
Thank you so much.
Thank you so much, Linda. I knew you were great with words, but I didn't realize that you had a really great voice as well. Thank you so much.
It's still early, so thank you. My voice wasn't quite awake, so I'm glad I pulled it off.
Sounded very good to me. Thank you so much. And I think, again, here, congratulations on the beautiful text. Linda, yeah, I'm really sorry, everybody. I know there were some questions that you would like me to have posed. But as for our MEP, Saskia Bremont, she said all questions that you have, you can address it to her office and they'll be answered. And I believe Joanna, the Council of Europe, she also added the link in the chat to the reports, so you can download them there or have a look on their website. And for the rest, I would just like to thank everybody who's been here today with us, for all the participants. Thank you to our speakers. Thank you to Jessica, to Nana, Paco, Kaboom, Shukri, Mashaga, Maya. Thank you to Saskia Brigmont. Thank you, Joanna. Thank you, Chiara. Thank you all for everybody for being here. Thank you to the team of GAMS, Forward UK, and Médicos del Mundo for all the work you've been doing behind the scenes, because always not very visible, but a very crucial work. Thank you, everyone, and hopefully see you soon. Stay safe in the meanwhile.